Diabetes is capable of slowly damaging the vessels of the body, thus causing major complications in the long run. High sugars cause atherosclerosis, which is basically thickening of the vessels, which in turn leads to narrowing, thereby reduced blood supply to the end organs. It affects both the small as well as the big vessels in the body. When minor vessels are involved, it could affect the eyes, the kidneys, or the nerves. When it affects the eyes, it mainly affects the retina, which is the back portion of your eyes, which is responsible for vision. There may be blurring of vision or floating particles in your vision, which may ultimately lead to blindness. It can also cause cataracts as well as increased eye pressure, which we call glaucoma. In glaucoma, there is pain and redness of the eyes, which may also lead to visual problems. Treatment for retinal damage includes special injections as well as laser. However, it will not undo any damage which has already been done. It is only going to stop it from getting worse. In addition to blood sugar control, we recommend yearly eye checkups with your ophthalmologist to prevent this particular complication. Kidneys. When it affects the kidneys, it mainly damages the small vessels. It affects the filtration of the kidney. The damaged filter becomes leaky and lets protein into your urine. Initially, it will be frothy urine. Later on, it may worsen, leading to swelling of your hands and feet and may also cause breathlessness. It can progress to advanced kidney disease, which will require dialysis. A 6-monthly or an annual urine check for protein is recommended to avoid this complication. Nerves. The nerves of the feet are primarily affected. There is tingling sensation or numbness in the feet, which gets worse at night. There may be a burning sensation as well as pain. Loss of sensation may lead to serious foot problems like ulcers and infections due to unnoticed injury. Thus, a regular hand and feet examination and a proper foot care is recommended. When major vessels are involved, it could affect the brain, the heart, or your legs. Reduced blood supply to the heart can cause a heart attack. As nerves are also affected, a diabetic may not experience the pain, which may lead to a silent heart attack. Also, in diabetics, they present with multiple vessel involvement. Thus, more often than not, they require bypass rather than a stent. Reduced blood supply to the brain can cause stroke. Stroke requires a long-term rehabilitation. Reduced blood supply to legs is what causes pain in legs while you're walking. In severe cases, it may lead to blackening, which we call gangrene. It can cause infections and ulcers, which worsen and may also require an amputation. Thus, early detection and a good blood sugar control is the key to prevent these complications. Also, you keep your BP in control and you need to stop smoking. Doctors often prescribe medications which are called as statins to lower your cholesterol levels and also blood thinners like aspirins to avoid vascular complications. Thus, a good dietary control, exercise, taking medications regularly in addition to a 6-monthly or a yearly checkup will improve the quality of your life by preventing these complications in a person with diabetes.